Sokol, MEP, and the floor is yours. Thank you.
Thank you very much. Thank you for organizing this. And I'm here now kind of in a dual role, also as an academic in the area of health law, member of European Association of Health Law, and this is definitely the focus of my academic interest, but also as an MEP who is active in the European Parliament on health issues, especially as the member of the Special Committee on Beating Cancer, the BECA committee, which was set up last year in order to make a report on the Europe's Beating Cancer plan and define the European Parliament's position on the fight against cancer and what we can do in this sense in the future. So today I'll be focusing on Europe's Beating Cancer plan, but I will just in the beginning mention the whole context, the whole setup which led to the adoption of this plan, and also what we are doing in the European Parliament about this, because this is, I think, important because it touches upon many issues which are related to European Union health law. So at first, what I would like to say, what I would like to emphasize is that you all know that healthcare traditionally is not one of the focuses of the European Union policies. The main reason for this is obviously the division of competences between the member states and the EU, where member states have primary competence and the EU can only support national measures. But this was in many cases used as an alibi for not doing enough on the European level, and the main reason was that there was no real political will within the European institutions, within the Commission, and especially between the member states in the Council to actually do something meaningful in the area of healthcare. This has started to change. Obviously, the main issue here is COVID-19, which has put healthcare in the limelight of European Union actions in general. But actually, this development, this evolution of EU health law and EU health policy has started even before. And I think we can trace it back to the European elections in 2019, where the biggest political group, Spitzenkandidat Manfred Weber, made beating cancer one of his most important policy priorities on the European level. So the political reason was that, so we want to show that European Union is not something abstract, something in the Brussels bubble, but that we can actually do something to help people to make their lives better and easier. And this policy shift has resulted in the adoption of the Europe's Beating Cancer Plan and the setup of the Special Committee on Beating Cancer. So these are two most important things which have resulted from this political initiative. And now we have this plan. It was adopted and presented by the Commission in February, and this is something which is now the basis for many future actions, legislative, financial, budgetary actions in this field. Also, what is important when we mention European Health Union, so the COVID-19 crisis and the shift towards healthcare as one of the priorities has resulted in this concept of European Health Union. Of course, the main goal, the main objective of this is to better prevent and address future pandemics, but also to improve the resilience of Europe's health systems. And now, of course, since the focus is on COVID-19 and the public health emergencies, these are also the priorities of the European Health Union. But Europe's Beating Cancer Plan is also one of its priorities, one of its main pillars. So beating cancer continues to be within the focus, within the limelight of European Union policies in this sense. When you speak about European Health Union, I think, just a short comment, it sounds better than it really is. So it does not really specifically or precisely define what actually it will be about. So it just mentions strengthening of some European agencies like EMA and ECDC, but in terms of some big overall legislative change, legislative initiative or something like that, it's something which is not really very strong in my opinion, or at least it doesn't sound like this at this time. We'll see what happens with this concretely, but currently it's not really precise about what concrete legislative regulatory measures will be taken in the future. Okay, but what is important is that the Beating Cancer Plan is one of the pillars of the European Health Union. And now I will focus on the main actions, the key actions, key areas of the Beating Cancer Plan. I have a lot of slides here. I will not go into detail about each and every issue, but I will try to focus on one most important issue in each of these areas. And of course, what is important about the plan is that it's the first plan, and I think that is its main added value, which is really all-encompassing. So it's not just about treatment, which is usually the focus of policy actions on national and EU level, but it covers everything from research and innovation for new treatments, new medicines, etc., to prevention, early detection, treatment, afterlife for cancer survivors. So all of these areas which are kind of mentioned in a systematic manner. So this systematic overall overarching approach towards beating cancer is, I think, the main added value of the plan in general. Okay, and the first area which is mentioned here is research and innovation. Here we have some initiatives like the creation of knowledge center on cancer for increased coordination, launch of European Cancer Imaging Initiative, expanding the European Cancer Information System. But I think the most important issue and action here is the creation of the European Health Data Space. So this is something which should be proposed as a legislative proposal by the end of this year, hopefully. And the idea is that we create the European Health Data Space where health data will be interconnected, interoperable, where health data from one member state will be used, and there will be possibilities to use it in other member states as well. Because currently these different rules, different regulatory systems, different protocols on how to use data in different national healthcare systems create big problems, especially in terms of clinical trials, which you want to encompass several member states, problems for European reference networks which are based on cross-border healthcare directive. So the exchange of data in this sense. So interoperability of data or lack thereof is one of the big problems of in terms of providing healthcare on EU level. So creation of European health data space with concrete regulatory solutions and concrete rules, harmonized rules on EU level will be a main, I believe, added value in this area. So I think that creation of European health data space is one concrete legislative initiative which we expect by the end of this year. And in addition to this, it's not mentioned here, but I think it is important. But this is something which was already done before the adoption of the plan. Is the fact that beating cancer has become one of the priority missions of New Horizon. So in the New Horizon program, which is bigger than ever, not as big as we would like to in the European Parliament, but still pretty big. Beating cancer will be one of the funding priorities for Horizon, and this will also be reflected in the budgetary part, which I'll be analyzing in the end. Okay, so the next key action is prevention. So prevention is something which is really mentioned a lot in the plan and also in the Parliament as one of the main added values of the plan in general. And here, one really concrete measure, one really concrete action, which will be the priority and which will be also supported by EU funding, is to eliminate cancer which are caused by HPV. Of course, the cervical cancer is the most important one, but there are also other types of cancers which are connected to HPV as well. So the concrete aim, so here we have a really concrete aim, concrete objective, is to vaccinate at least 90% of the EU target population of girls by the age of 2030. So here is one area where we have very concrete objective, concrete benchmark, and also pretty concrete funding for this, which will not be the case in other areas. Okay, so this will be the main action in terms of prevention. But the other thing, which is also pretty concrete in the area of prevention, is the creation of a tobacco-free generation. And the idea is here to actually revise, but not also only on tobacco, but also on alcohol, to revise the taxation rules, especially excise duties and VAT rules, in order to create disincentives for the consumption of tobacco and alcohol. This is something which is definitely already causing political problems and diverging opinions on this. And of course, you know that if you want to adopt EU legislation in the area of taxation, even indirect taxation, we need unanimity in the Council. So it is very doubtful how realistic is that we will be able to change all of this taxation legislation to really, what the idea is to increase. The idea is to increase prices of alcohol and tobacco and to create and make them less attractive for consumption. As I said, it's very doubtful whether this will work, whether this will be adopted at all, but this is what the plan is all about. And also there are the provisions on addressing unhealthy diets, obesity, physical and inactivity, etc. But this is not really, we do not have concrete legislative measures which are envisaged in this sense. So it's really hard to talk about these other areas. What is also important, one area which there will be also big challenges and diverging opinions, and there is already a lot of this, is about the alternatives to smoking, so alternatives to tobacco, especially e-cigarettes. So the Commission is very negative about this. So the Commission wants to put e-cigarettes within the same category in terms of unfavorable taxation, in the same category as normal cigarettes. But there are some scientific studies which are challenging this idea and which is saying that in some cases e-cigarettes and these alternatives to tobacco can be used as a kind of a harm reduction measure. So in cases where people cannot just completely stop smoking, so to use this as something which will create less damage for people in terms of for their health than classic cigarettes, typical cigarettes. Of course, in this sense, Commission is still very negative as it was before, and you know that there are some judgments by the Court of Justice. I think there was a Swedish case about this where the court essentially said that the Commission has the autonomy to decide on basis of scientific evidence whether it wants to maintain this very negative attitude towards e-cigarettes, vaping, and all of these alternatives to tobacco. Of course, the precautionary principle is one of the reasons which Commission is citing in terms of having this very negative opinion. But if you look at scientific studies, they are really also they diverge. So there are some scientific studies which are saying that e-cigarettes and these alternatives will not help much in terms of reduction of the numbers of smokers and reduction of cases of cancer. But there are some other studies. I think one was UK based, which says that actually they can help a lot. So this is one area where there is a lot of opposition to what the Commission is doing. But the main the policy of the Commission as it is now is to really be very negative about these alternatives to cigarettes and to put them in the same basket as smoking cigarettes itself. Okay, so this was about prevention. Now we have early detection. So the development of a new EU cancer screen, and the aim here is to ensure that by 2025, 90% of the target population is offered breast, cervical, and colorectal cancer screening. So this is also one area where we have some concrete targets, and we should have some concrete funding. But I'll get to this in a moment. You'll see that maybe the funding which is envisaged more in concrete terms in the plan will probably not be enough to do this. So my impression is that this will be that national funding will be the basis for this. And of course, if we have national funding as the basis, probably there will be big differences across different member states in terms of the final effects and results. And the other actions about early detection are about soft law. So updating Council recommendation on cancer screening, developing new guidelines and quality assurance schemes for screening, diagnosis, treatment, and rehabilitation, updating the European Cancer Information System, etc. So these are typical soft law measures which are in abundance. If you look at the plan, the biggest part is covered by these soft law measures like recommendations, guidelines, creating of new systems of coordination. But how this will be effective is, as you probably know, based on previous experience, very, very doubtful. Okay, so now this brings us to the standards of care. And in the standards of care, the most important thing, the most important new measure proposed is the creation of national comprehensive cancer centers. So here the idea is not to have specialized cancer centers in different regions, which will cover different member states and cross-border regions, which was proposed by me, for instance, and other MEPs in the parliament, but to have one center in each member state, which will be basis for research, innovation, teaching, and coordination of all actions against cancer within the individual member states. I think this is a good thing. This is a good added value, but you will see that in the end that we do not have concrete funding on how to build this network of comprehensive cancer centers. And as I said, the question is, in big member states, in border regions which are relatively far away from these national centers, the provision of healthcare will not really be really affected by having these comprehensive cancer centers, because patients will still have to travel 100 or 150 kilometers to reach the best possible cancer care, which I think is not really a very good thing. There are also some additional initiatives, like launching a cancer diagnostic and treatment for all initiative to improve access to innovative cancer diagnosis, launching Uncan EU to help identify individuals at high risk from common cancers, and other programs as well. Of course, here what is important here, but this is not a new measure. This is an old measure. Is the adoption to finally adopt the regulation on health technology assessment. You know that this regulation has been stuck in the council since the previous mandate of the previous parliament and the commission. We now have some signals that the situation will improve, but we do not have the final outcome, the final outcome of negotiations yet. So we'll see what happens with this. But this is an old measure, so this does not really fit into this framework. And what fits into this framework is the establishing a group of new reference networks on specific cancer types. So this is a concrete measure. So to widen and expand the existing ERNs to cover other specific cancer types, and I think this is very important, especially for rare types of cancers where you do not have top quality expertise in all member states. So exchange of data on basis of ERN here will be crucial. But again, we'll see about the concrete funding in this sense. Okay, so some other measures as well, setting up a partnership on personalized medicine, developing a roadmap towards personalized prevention. I won't go too much into this because we don't have a lot of detail in the plan, but this seems to be mostly something which will be soft law, which will be kind of a coordination without concrete legal measures to back it up. Okay, so this brings us to the next part of the plan, and this is quality of life. So quality of life, especially for cancer survivors. So here we have the idea of creation of cancer survivor smart card. So which sounds like a good thing, but we still don't know what this card will actually amount to, what it will actually do. So this is one thing. The other is ensuring full implementation of the directive on work-life balance for parents and carers. But this is not new. This is not new legislation, but this is about improving the implementation of the existing one. And then the last one is to address fair access for cancer survivors to financial services. So I will just briefly stop here, because this is something which is called within the European institutions and some member states as the so-called right to be forgotten. So right to be forgotten is the idea that cancer survivors, usually after 10 years of being cleared from cancer, being diagnosed as being free from cancer, so that they can enter into mortgage loan contracts, insurance contracts without being discriminated against. Because currently we have the situation that a lot of these cancer survivors suffer discrimination, and they have to pay much higher premiums because of having gone through cancer than other people. So the idea is to have legislation which, after a certain amount of time, will provide for this data not to be gathered, not to be collected by the insurance company, so that these people are in the same position as the other people who have not survived cancer. Why this area is important? Because here actually we already have the existing EU legislation, which we just need to change. So we have existing EU directives which regulate insurance market, which just need to be amended. Maybe just change 2 or 3 sentences to introduce this right to be forgotten. So here we do not have the problem of the division of competencies, etc., because this is insurance, this is internal market. So in this area we can act without any special legal obstacles. And what is important here is that currently 4 member states already have this legislation, so the Benelux countries and France. And of course, in cases like this, where some countries prohibit discrimination like this and some other countries not, people in other countries are in a worse position than people in those countries which have these provisions in their national legislation, which means obviously that we have a need for harmonization, and this harmonization, as I said, can be done in legally very, very easy manner. Unfortunately, the Beating Cancer Plan does not mention the amendment of concrete existing legislation, but leaves this possibility, but does not provide for this explicitly. It just explicitly mentions the creation of a code of conduct, which will be kind of agreed with the insurance institutions, insurance companies, and this code of conduct will provide for this right to be forgotten. But of course, code of conduct is not something legally binding, and this I believe is not enough and this will not provide sufficient legal guarantees for cancer survivors not to be discriminated against. So this is something that European Parliament is strongly advocating, and I think that the BECA committee report on the Beating Cancer Plan will include the call to have some more concrete legislative initiatives in the area of financial services, not to prevent discrimination of cancer survivors from occurring. Okay. Next issue, a big issue, also very important in the Parliament, is about reducing inequalities. So the inequalities in terms of access to top quality healthcare, in terms of health outcomes across the European Union, is well documented, especially in Central and Eastern Europe. I also wrote some papers about this, and this is one of the main problems of the European Union health policy in general. So that there is a 30 or 40% bigger chance of dying from cancer in some countries of Eastern Europe than in countries of Western Europe. And this is recognized as one of the most challenging, the biggest challenges, the biggest problems of the European Union in general. So what are the key actions provided here? So the main action is launch of Cancer Inequalities Registry to map trends in key cancer data and to identify concrete inequalities between member states and regions. So we have this, we have some other actions as well, but these actions are not really concrete. So we do not have any concrete provisions on cohesion policy, allocation to invest into health infrastructure, into health professionals, etc., in order to improve access to healthcare in all parts of the European Union. So we do not have very concrete financial provisions on this, and we do not have any concrete provisions about what to do with existing legislation which we already have, which can reduce these inequalities. And one of the main pieces of legislation here is the Cross-Border Healthcare Directive. So Cross-Border Healthcare Directive is mentioned in the plan, but no concrete measures, no concrete ideas on what to do with the Cross-Border Healthcare Directive, how to address the problem that cross-border healthcare is still a very seldom phenomenon, that not a lot of people is utilizing these possibilities. So the plan does not really provide much in terms of what to do with cross-border healthcare and how to improve access to cross-border healthcare in the European Union. I have to say, to add to this, I had some informal contacts with people from DG Sante on Cross-Border Healthcare Directive, and they told me that they are currently in the process of creating creating a public discussion about where to go in terms of amending the Cross-Border Healthcare Directive. So it is possible that next year we'll have some kind of a proposal on how to amend, how to change the Cross-Border Healthcare Directive, especially the reimbursement rules. But as I said, at this moment, nothing concrete yet. Okay, so there are also some provisions on childhood cancer. So childhood cancer is recognized as one of the biggest problems in terms of different possibilities to access cancer, and this is one of the biggest problems because many types of childhood cancer are very rare. So this falls within the notion of rare diseases, where in many cases you do not have adequate infrastructure and personnel in all member states to provide treatment for all types of cancer. So cross-border healthcare here is also important, but unfortunately, as I already said, there is not a lot of concrete actions which are provided there. So there is the establishment of EU Network on Youth Cancer Survivors, the launch of the Helping Children with Cancer initiative, but we still do not know what these initiatives will will be concretely about. So we do not know what concrete measures will be covered by these initiatives. Okay, and the last but not least, obviously the funding. So as I said, the problems in many areas of the beating cancer plan is that we do not have concrete actions envisaged. So if we want to see where the concrete priorities will be, we have to turn to funding. And if we look to funding, we can see that around 4 billion euros is allocated for the implementation of the plan, 2 billion euros from Horizon Europe, €500 million from Erasmus, European Institute of Innovation and Technology, and Marie Curie actions, Digital Europe 0.25 billion euros, and EU for Health 1.25 billion euros. So if you look at this funding, you can see that actually the most concrete actions will be in the areas of research and innovation, but these are areas where funding was already provided even before the adoption of the plan. So the idea that beating cancer will be one of the priority missions of the Horizon was already agreed upon last year before the adoption of the plan. So if we take this Horizon Europe part, research innovation aside, because it's already provided before, we can see when we look at the additional funding, concrete funding, that we do not have a lot of real concrete funding for a lot of concrete actions. Which means that the biggest problems, and this is the differences in terms of access to quality healthcare, rare diseases, pricing of medicines, problems with lack of healthcare professionals and medical infrastructure in some regions and member states, that these problems will not really be addressed by the funding from the plan, but by other measures. The plan also mentions other sources of funding like cohesion policy, which is traditionally the biggest source of funding for health infrastructure and personnel from EU budget, but it's not really precise and concrete about how this cohesion policy will be used to reduce these inequalities on European Union level. So we don't have concrete funding, it's concrete percentages of cohesion policy funding. So it seems that this will still be left to the individual member states, which will, within their national programming, decide which parts of the cohesion money to allocate for healthcare purposes. And of course, here again we'll have big differences across the member states. Okay, so to sum up, so that I leave time for the Q&A. So some conclusions that about the plan. So first, it is the first systematic EU strategy on beating cancer, and I think this is the main added value. So this is the first strategy which will be really used to cover all aspects of related to cancer, all aspects also of healthcare policy, including concrete measures, including health treatment, life of cancer survivors, healthier lifestyle, tobacco, etc., etc. So this is the first strategy which looks at this as a kind of a systematic problem which needs a holistic approach. And I think this is the main added value of the plan, and it provides for a wide variety of activities. These are the positive sides. The negative the main negative side is that I think that we lost a chance to go much further than is provided by the plan. Much further in terms of having more ambition, in terms of more funding to reduce healthcare inequalities, to have concrete pieces of EU legislation to try to equalize standards of healthcare provision across the EU, to have more ambitious rules on health technology assessment, because even this regulation which is proposed is really not ambitious, very ambitious. It does not contain cost effectiveness analysis. More ambitious rules in terms of procurement of expensive medicines. So all of these big problems of outflows of healthcare professionals and how to create incentives for them to stay within their member states, which have problem of lack of health professionals. So all of these big problems and challenges which exist on the EU level, I believe, will not be really resolved by the beating cancer plan. And I'm glad that this is to some extent a lost opportunity to really go much further than is already than is the situation currently. Of course, the division of competences is always the problem. It can always be used as an excuse not to do enough. But I think I showed you that in some areas like cross-border healthcare, like health technology assessment, like right to be forgotten, we actually already have some pieces of EU legislation which just need to be amended to make healthcare provision, and especially related to cancer, to make it much better than it is now, and to make life for cancer survivors and cancer patients much more bearable than the situation is now. So this is the main problem. So lack of concrete binding legislative action, lack of concrete sources of funding, which is mainly limited to research, but also imbalance in different fields in terms of benchmarks and concrete actions. So you can see that in some areas like early detection and prevention, we have concrete benchmarks and concrete objectives. But in the areas of standards of healthcare and reducing inequalities, we really do not have concrete objectives of what we want to achieve. And without concrete objectives and concrete benchmarks, of course, it will be very hard to measure the actual impact of the plan in the end. So to sum up, I think the plan is a step forward. The fact that it is systematic, that it puts beating cancer within as one of the policy priorities of the EU, but I think it could have gone further and much further than it did. I think that it could have provided much more concrete provisions in terms of binding legislative action, much more concrete funding. But I think also what is important is that the plan as it is now can be used as a basis for other actions which are not specifically provided in the plan, because the plan itself is not an obstacle to be more ambitious in some areas which are not concretely provided by the plan itself. For instance, right to be forgotten. The plan only mentions the code of conduct. The plan mentions the reducing inequalities, and this can be used afterwards by the policymakers to even go one step further than is written in the plan itself. What is important is that the BECA committee is in general has the similar position as I have that I presented here now. We do not have big differences between political families. This is very important. We have some differences in terms of division of competences, what you can do, etc. But I think in terms of priorities and in terms of wanting more concrete action, the committee seems to be very united in this sense. So I believe that the report, it should be published, the first draft somewhere in July. Sometime in July, that this plan will actually call for some more concrete measures in terms of funding and legislation, and then after that we'll see in the dialogue with the Commission, we'll see what we can do in order to improve on the plan, but also on the implementation of the plan in the future. Okay, so I think I'm finished. I'm finished with my part. I would like to thank you all for listening, and I'm open to questions, comments, and everything that you want to share. Thank you very much.
Okay, thank you very much.